Hey folks, Dr. Sean Bryant here again with E3 Chiropractic and Wellness, and today we're going to be continuing our discussion on rib joint dysfunction. Specifically this week, we're going to be discussing some in-clinic treatment, things that we do in office here to address the issue. So first and foremost, one of our primary treatment tools here in office is going to be chiropractic adjustments. And typically with this rib joint dysfunction, it helps leaps and bounds. So what we're doing with that adjustive setup is we're finding the joints that are restricted in motion. We're taking them to a point of tension, and then we're delivering a light force pretty quickly to get some more movement at that rib joint. Now, this can be done in a few different ways as far as setup goes, and that's totally determined based on the patient preference and comfortability as well as the clinician preference and comfortability. So whatever setup that we can find the maximum amount of comfort with the patient and the best level of tension with the clinician to deliver an effective adjustment, that's going to be our setup. So I'll be showing you one little setup here with Kristen in office here today just to demonstrate how that can look and go about treating that rib joint dysfunction. Okay, so now that we've got our patient set up on the table, we've kind of predetermined that this was the most comfortable position for the patient. So we've got Kristen laying on her back, and then I will take her arms and just set them up like so. So then I will roll her over and find that sticky rib joint that we had predetermined in that physical exam. I'll take a little tissue pull here and get some tension here. We roll over and a little adjustment right there. And that's what that looks like. Okay, folks, so to finish off our in-clinic treatment here for rib joint dysfunction, we then like to follow up and kind of reinforce that motion at the rib joints. So we've kind of achieved a little bit more motion with the adjustment. Now we want to reinforce that with some movement. So I've got Kristen here set up in an exercise that we like to work on, and this is just a simple thoracic rotation drill. So I like to have the patient take this arm here and then place it on the small of their back. Perfect. And I'll ask them to rotate open as wide as they can. So we've locked out the lumbar lower back spine in rotation. We're trying to get this directly through the mid back here. Once we have that here, I just kind of coach the patient to take a few really deep breaths in, deep breaths out, and we're trying to get some distractive movement at that rib joint here through the respiratory cycle. So kind of uncomfortable to be in that position, but we start to work that the breathing and the expansion of the lungs with this rib cage to make this a little bit more difficult. Then I kind of help into that rotation and fight a little bit more, and then I'll get the patient to press their shoulder in towards my hand about 20% as hard as they can, just to kind of activate some of those rotary muscles. And then we get those to quiet down, deep breath in, deep breath out, relax, and then we sink a little farther into that rotation. So this is something that I like to kind of use in clinic to, again, reinforce that motion we just achieved, and we go from there. Thanks.